asthma versus pneumonia. What you should know about asthma versus what you should know about pneumonia. So please, topics. Please, can you give an overview of asthma?
Asthma is a chronic inflammatory condition that affects the airway. It's characterized by a narrowing of that airway leading to wheezing, yeah, leading to increased mucus production, yeah, that's basically it as my and difficulty in breathing. And then what about pneumonia? Pneumonia, it finds both of them have difficulty in breathing. They really because it does the causes. Yeah. So while asthma is like a trigger, pneumonia is an active infection of the lungs. So the lung tissue, the lung parenchyma, the alveoli, like that. Basically everything that's to do with the lung get infected. Yeah. Then does it affect both of them? They affect the airway, no? Only asthma affect the airways. That's why the symptoms are different. Then pneumonia actually affect the lungs. Can you give us the causes? The causes for asthma, like I said, asthma is more or less like a trigger. It hardly has to do with infection. Though sometimes upper respiratory tract infections can not but trigger asthma attacks. You get, but then again, like I said, the triggers are dust, cooling, smoke. Yes, see, so those trigger asthma attack. But for the causes of pneumonia, like it's infection, the bacterial infection, streptococcal. It can also be viral infection like COVID. So mostly they can then form that to just infect, and then also we can also have what they call aspiration pneumonia. Aspiration pneumonia is pneumonia that is caused by let us say food or food particles like when we vomit. So if the vomit goes through a different tracts, like let us say the trachea passes, lands on the alveoli, that's on the lung, that is what called aspiration pneumonia, which we are to cause difficulty in breathing, that constant cough and all. Then, not that the symptom, the cells are here in patient. Very major way to differentiate these two is one has fever. We don't find fever in asthma, but in pneumonia you have fever. So the similarity is how they call fine that you see fever won't be there. Now, the figures will also let you know for the asthma attack, we realize that you've been exposed to these dust particles, and maybe with an animal and you're rubbing the animal for so you have this attack. Your pneumonia it's different. Pneumonia is an infection, so you have fever, yes, you have pain in the chest, usually like at night. See, so not everything we have. So basically these are the symptoms for for asthma. Yes, you can also have the reason. You know, picture asthma as we are trying to breathe through a pipe. Yes, a narrow path. So you have reason here reason. So since it is um a condition that affects the airway, yes, that's you have those symptoms. That for pneumonia, it affects the lung itself. So your breathing will be fine. Yes, the sound you will hear that wheezing sound. Yeah, there'll be difficulty in breathing. Now the difficulty in breathing, your alveoli is a part of your lung that filters air. So imagine the part of your lung being covered by, let's say, food particles or blood or pus as a bacterial infection. You see that your enough oxygen will be getting to you have this fast breathing, your breathing beating will increase. So that difficulty in breathing comes in. So this alveoli near excess of gas is required. Yeah. So can you give us on the way of managing both asthma and then pneumonia? For asthma, inhalers are for pneumonia, the brand is inhaler. For asthma, both of them, yes, but now now it's now to make the use of that asthma. That asthma can be that inhaler can be a corticosteroid. Now those corticosteroids, what they do is they help to open up the airway. Remember, this inflammation that occurs during asthma narrowed the airway. Yeah, your body is trying to not let those dust particles. Yeah, the body is actually overreacting, so it's trying to let these dust particles not to get into the airway. So it narrows the airway. That's why you now have that difficulty in breathing. Now, when you use corticosteroids, they open up the airway. You see, so now that is the use of this corticosteroids as inhalers. And you can also use labutanol inhalers. We don't use because it is not a problem of the airway. That's for pneumonia. It's a problem of the lung. So say the lung is infected by bacteria, what you use will be an antibiotic. You see, so for asthma, you do not use antibiotics except the trigger is by a respiratory infection. So you treat that respiratory infection, then you will have the asthma. You see, but if it is just purely the asthma attack, which is caused by either those other triggers apart from respiratory infection, no need for antibiotics. You just use your salbutamol or your regular corticosteroid inhaler, and for the pneumonia itself, you use antibiotics since it is an infection, like let's say a bacterial infection. So you can also use do fluid management quick enough with there. In worst case scenario, you use your oxygen therapy as big male even. Okay, then we manage that. Well, back to the asthma. You avoid the triggers. If they are cooking, the smoke kitchen, you avoid those areas. So that's here for the management. Then also you learn the little inhalers, application of inhalers. So yeah, I think this is great as well. Then for that investigation on the like for asthma, when we check your lungs on X-ray, the X-ray reveals a normal lung. The way we check the chest X-ray for pneumonia, you see consolidation, you see spaces, yes, on the X-ray. The lung is not clear. The lung is not clear. That's what they call consolidation. See increase or opacities on the lung space. Yeah, so that so both asthma and pneumonia, they actually lead to difficult breathing. I'm still curious. What is the significant difference between menstrual and non-fever? Yes, no see fever, and also the way of the living. For pneumonia now, when you use inhaler, you won't have it. But for asthma, you will. Yeah, but then again, fever. You have fever in pneumonia, but you won't have enough. Your evidence will become the air of fever. What other significant difference we have? Well, for investigation already proved the chest X-ray will reveal a clear lung for asthma, then a consolidated lung for pneumonia.